In this video, we will demonstrate a brain-computer interface, or BCI, that uses speech-modulated cortical electrical potentials for the control of a computer cursor. This research was conducted at the bedside in the Clinical Epilepsy Monitoring Unit at Washington University in St. Louis. The two patients demonstrated here previously underwent a left-sided craniotomy for placement of a subdural electrocorticography, or ECOG, electrode grid for the clinical purpose of seizure monitoring. Both individuals performed a similar task aimed at volitional control to move a computer cursor left or right towards a randomly displayed target. The stimulus presented to the patient is shown on the right of this video, and a recording of the patient is shown on the left. The face is obscured, sparing the mouth to observe speaking. When the target is displayed on the left, the patient is asked to voice the phoneme ah to move the cursor toward the left target. Similarly, when the target is displayed on the right, the patient speaks the phoneme oo to move toward the right target. A previous screening trial was performed without cursor control in order to select the electrode and frequency band that is best modulated by speaking. This electrode and frequency band, referred to as a feature, is then transformed into the cursor's velocity on the screen. The novelty of this approach is to extend the range of features in the electrocardiogram available for use as a signal to control an external device, in this case a computer cursor. Because speech is a uniquely human cognitive function that is not able to be tested in animal models, it therefore relies on human volunteers. The methodology demonstrated here for BCI control through speaking phonemes can similarly be reproduced with imagined speech. Therefore, in the second exemplar, we asked the patient to simply imagine speaking, but not to actually voice the sounds or move their mouth. In this video, the patient is presented with a similar target on each side of the screen and given similar instructions to imagine saying ah for the left and oo for right. The text and response bar are overlaid on the video post hoc for demonstration purposes, but were not displayed to the patient during covert BCI performance. During imagined speech, she was able to achieve similar levels of performance as when overtly speaking and using the same electrode and frequency band features for closed-loop BCI control. These are examples of going beyond traditional motor control signals for neuroprosthetic applications. Here we demonstrate using a speech-modulated signal from a human performing closed-loop control of a BCI application. Extension of this modality for more extensive use of speech and in combination with more traditional motor control features is expected to broaden the reach of neuroprosthetic applications.